Do you have pain on the side of your hip, right where your thigh bone kind of is closest to the surface? Does that pain increase if you walk for a long distance or a long duration? Increase when you go up and down stairs? Probably increases if you lay on this side? If so, you've probably been diagnosed with something called hip bursitis, or more specifically, trochanteric bursitis. And if you've been diagnosed with that, you've probably been shown some stretches for something called the IT band, or ilio-tibial band. It's a tendon on the side of your hip. Stop doing these stretches. They almost never work for this problem. And today's video is about what exercises work to help get rid of lateral hip pain. So why doesn't stretching, and specifically stretching the IT band, that tendon on the side of the leg, why doesn't this work for getting rid of hip bursitis or lateral hip pain? Here's why. The problem is almost never the bursa, the fluid-filled sac that's under that tendon. That's almost never the injured part, the pain-producing part. The pain-producing part are the tendons that attach to this bone. It's called the greater trochanter. It's part of your femur. These tendons can wear down with time as we get a little older, as we're a little more sedentary. The muscles get weaker and the tendons can break down. And therefore, the really effective treatment for this problem is strengthening these muscles and tendons. And that's what today's video is about. Before I demonstrate the first exercise, I want to remind everybody, click those like buttons, leave a comment, subscribe. That really helps me grow the channel. Okay, first exercise we call isometric hip abduction. So in this example, it's my right side, that's the hurt side. So I have a band around the knees, and use an easier band for this exercise, not a real stiff band. You'll want something to help with balance, and you're simply going to raise the leg out to the side and hold that for 5 seconds. The hold time is an important part. Time under tension is one of the variables that seems to stimulate these tendons to heal themselves over time. So kind of longer hold times for these movements. Come back, 5-second hold. And again, lift the leg out, not really far, hold 5 seconds, come back. We'll do 10 reps. Over time, work up to a 10-second hold for each repetition. And then once you can do that, move the band from the knees to the ankles. That will increase the difficulty. Same thing. Lift the leg to the side, hold 5 to 10 seconds, 10 repetitions, once a day. The next exercise is a banded squat. So I still have a band around my knees, and I like using a bit of a stronger band for this exercise than the prior exercise. So anyway, band around the knees. The point of the band is it wants to pull my knees inward, and my hip muscles that we're trying to work are having to fight that to keep my knees about over my feet. With that tension, I'm simply going to do about a half squat up and down, about 3 sets of 10. Now, one thing to keep in mind, keep your weight back a bit. In other words, kind of stick your butt out when you squat. This forces the hip muscles to engage. What folks tend to do is they tend to fall forward as they squat. They tend to put their weight through their toes, kind of concentrate on keeping the weight in the heels. That keeps your hips back a bit, and again, keeps the hip muscles engaged throughout more of the exercise. This next exercise is again one of those time under tension exercises. It's a little bit confusing. So in this example, it's my left leg, that's the treatment leg. So I have my medicine ball up against my bench. So you might have a ball up against the wall, even a rolled up towel against the wall, anything to push this leg, my non-treatment leg, into. So I pick up my right foot, I push into the ball and hold. So as soon as I start applying pressure to the ball, my hip muscles on my left side engage, and that's what I'm trying to create. Push, hold, a long hold time, 10 to 15 seconds, relax. Lift the foot a little bit, push into the ball, hold, 10 to 15 seconds. You'll really feel the hip muscles on the left side working. I know that seems weird, it's a little confusing, but it works great. Relax. Lift, push, hold, 10 to 15 seconds, 5 to 10 reps. Our last exercise is a banded bridge. Again, still with the bands. Again, the point of that is to keep those lateral hip muscles working. That's the whole point. So I'm keeping my knees at about shoulder width throughout the movement, and I'm simply going to lift my butt up off the floor, hold for a count of 5, come down. Up, pushing through the heels, hold for a count of 5, come down. 10 to 15 repetitions. Those are my go-to exercises for my patients who have lateral hip pain, what I think is more correctly called gluteal tendinopathy, because again, it's more of a tendon problem rather than hip bursitis. It's almost never the bursa. And again, that's why stretching at best doesn't tend to work. At worst, might actually be harmful and prolong healing. That you've got to start a gradual progression of side hip muscle strengthening to solve this problem. I hope this video was helpful. I hope it helps you get back to what you love to do. Again, like, subscribe, leave a comment, and we'll see you in the next video.